Hello and welcome back to the channel. So today we are going to discuss some important devices which are commonly used in gynecology and obstetrics. I am Dr. Azmat Riaz. I'm a clinical assistant professor at the College of Medicine, Ajman University. First, we will start with intrauterine copper device. It's called IUCD or more commonly simply IUD. So what exactly this is used for? This is used for contraceptive purposes. So it's a contraceptive. That's its only purpose. Okay, it does not provide any other benefits. Now, why it is called intrauterine copper device? Because it contains copper, and the amount of copper it varies. It comes in different quantities of copper. Okay, so and how much is copper? It depends on for how long it can be used for. So in general, most of the devices which we use in the UAE, they are for 5 years. So how do we know? It's usually written at the back of the. It's on written on the packing actually. Okay, so it's easy. Just have a look there, and we know for how long it's used. So when is the best time to insert? That's during the last day of the periods. So why is that so? Because during the last days of periods, the cervical os that's still opened and the flow of blood that has reduced. So because if we insert it during the, say for example, first 3 days of the cycle during menstruation, there are high chances that it can be expelled with the high flow. Okay, so now I'm going to discuss which women should not have it and the possible complications. Okay. So, what are the contraindications which women should not have it? Any women in which we cannot confirm whether she is already pregnant or not. Okay. So remember that no contraceptive is 100% protective. Okay, even after surgery, even if the fallopian tubes are blocked, tubal ligation, still 1 out of 200 women can get pregnant. So the copper device is quite effective, but again, it is not protective. And even before inserting it, we have to make sure that patient is not pregnant already. Okay. Now, and the second one is unexplained vaginal bleeding. If a patient has been having bleeding and we don't know the cause because it may be something serious, right? It can be an endometrial hyperplasia, it can be a problem in the cancer or a precancerous stage. So we have to detect it, or even it can be again a pregnancy. Then the inside of the uterus, the uterine cavity, it should be regular, because if there are bulges inside the uterine cavity, because this goes inside the uterus, right? So if the inside of the uterus that's not smooth, there are irregularities, for example when there are fibroids inside the wall of the uterus, or if the shape of the uterus is not normal, then it should not be placed. Okay, for a woman, this is very important. For a woman who usually has very heavy periods or heavy periods, because this copper device causes heavy bleeding. Okay, it is likely to cause heavy bleeding, so it's a contraindication. Please remember this. And how do we know it? Of course, in history taking. Then current pelvic inflammatory disease. So if there is infection currently in the uterus, that's a contraindication. With previous pelvic inflammatory disease, yes, it can cause pelvic inflammatory disease, but for previous one, we have to assess the risk and benefit ratio. Okay. History of ectopic pregnancy. So if a woman has a history of ectopic pregnancy, because as I said, no contraceptive is has 100% efficacy, right? It cannot protect all pregnancies, even the best contraceptive in the world. And if there is a pregnancy with intrauterine copper device, if the patient gets pregnant, then it is likely to be an ectopic pregnancy. Because how does it work? Basically, intrauterine copper device causes local inflammation in the uterine cavity. So its main mechanism of action is producing a local inflammatory environment in the endometrium, and hence it prevents implantation into the uterus of the embryo, right? But text also suggests that in some books it's written that it also can interfere with fertilization, but its main mechanism of action is prevention of implantation. Then women who have copper allergy, or if there is infection in the cervix which has not been treated, or if there is problem in the cervix like abnormal cervical screening, then if a woman delivered recently, or even if she had a miscarriage and there is infection there, so I just want to clarify that IUD can be placed soon after a C-section or a vaginal delivery or a miscarriage. Okay, so that's an ideal situation. We will discuss about that later. But if there is infection, or if there is heavy bleeding soon after a birth or a C-section or a miscarriage, that becomes a contraindication. Then any situation where there is infection inside the endometrium, which is the inside of the uterus, or the myometrium, which is again the uterus, right? A pelvic tuberculosis, so again any kind of infection. And now this is important: avoid in nulliparous women, which means that copper IUD should not be placed in women who never had any children. Okay, because one of the side effects of copper intrauterine device is it can cause pelvic inflammatory disease. It can cause infection in the uterus, and that infection can also involve the fallopian tube. Once fallopian tubes are involved, fallopian tubes are very sensitive organs. Okay, so it can block the fallopian tubes and it can cause infertility. Okay, if only if it causes pelvic inflammatory disease. So as a result, it should not be given to women who never had any children. Okay. Now, what are the side effects? So, side effects can be short term, like when we are putting it, or as in long term complications. So, at the time of placement, there can be pain and trauma to the cervix or even to the uterus inadvertently. If, especially if the healthcare worker is not trained, we can make a small hole in even in the uterus. Okay, it can come out, and hence patient can become pregnant thinking that it is already there. She may lose it, right, during periods, heavy periods, and she can get pregnant. And sometimes even when it comes a little bit down in the uterus, it may be still present in the uterus, but it may be slightly displaced, and then that increases the risk of having pregnancy and ectopic pregnancy. Uterine perforation means we can make a small hole. Pelvic inflammatory disease. So pelvic inflammatory disease, but theoretically they say that IUCD causes only PID in the first initial weeks. Clinically, we see that some women come even after many years. Okay, and the particular microorganism which causes it, it's called Actinomyces israeli. That's the name of the bacteria. Unusually heavy bleeding. So we said that it's a contraindication. Worsening pelvic pain and dysmenorrhea means it can cause period pain. Okay, severe abdominal pain or tenderness. Like it depends on, yes, it's related to period pain, and especially if there is infection, it can lead to general pain. So rest we will discuss in the next part of the video. Sometimes the women think that the IUCD is lost. Okay, so we will discuss about that